failure we're going to talk about is that left ventricle. That left ventricle pumping, not pumping satisfactorily, and blood will back up, and that blood backs up into the lungs. And if we look at a chest x-ray, what might we see? Well, we might see some big distended veins extending into the upper lungs like we're seeing over here. We might see some of that edema extending into the lung fields like we're seeing here, this kind of ill-defined hazy density. And we may see some interstitial edema, these little lines collecting on the periphery of the lungs. So we might see that interstitial edema. But that's what we might see on a chest x-ray. What would the patient experience? What signs and what symptoms would we be looking for? And the signs and symptoms we're really going to see are really just a function of that edema. And that edema is that fluid building up. And we've talked about that fluid building up in the lungs, backing up into the pulmonary veins and backing up into the interstitial tissues of the lungs and into those air spaces of the lungs. But that edema is going to make it a lot harder for the patient to breathe. So the patient's going to experience a shortness of breath, and we'll abbreviate that SOB, shortness of breath, and difficulty breathing, or increased tiredness with breathing. So shortness of breath and difficulty breathing. Now that makes sense. The patient would have difficulty breathing and shortness of breath. Well, from our diagram, here's our microscopic picture. Well, that pulmonary tissue, those capillary walls, those air spaces now are very edematous and very thickened. They have all of that edema fluid, some of it spilling out into the air spaces there. So for that oxygen to transfer across that membrane is really going to be much more limited now because of all that edema build up in the lungs right there. So difficulty breathing, shortness of breath, symptoms of tiredness, that feeling of fatigue, as though someone has just climbed up several flights of stairs, but really they just tried to walk across the living room. And that's that shortness of breath, difficulty breathing we'll talk about, but really it's just a function of that transfer of oxygen across that membrane, and the patient is no longer able to freely move air across that membrane because of that edema that's built up in the lung tissue. So what might our friend do? Try to compensate for that? Well, they might try to breathe faster. Breathe faster. Tachypnea is the word there. Tachypnea. It's the same word as tachometer that we will use in a car. It measures your RPM, so revolutions per minute. But the medical word is tachypnea, which is basically just means fast breathing. What else can we have? We will have something else we'll talk about. The patient may have difficulty lying down with all that fluid in the lungs building up there, pooling in the lungs, all that edema building up. They may have trouble down flat, and that word is we're going to talk about, difficulty lying down. And that word for difficulty lying down is called orthopnea. There's another big word for you, Colt, and that word to describe difficult breathing with lying down is called orthopnea. And that word for difficulty breathing, shortness of breath, that we've just been talking about, the word we call it medically is dyspnea. So those are the words we're going to talk about. Dyspnea, tachypnea, and orthopnea can all be parts of that edema building up into the lungs. Well, where else can it build up? So where else would we see that fluid back up? Well, again, here's our friend here. We drew a picture. He's not very happy. He has his heart failure. His left ventricle's backing up. But again, if we're thinking about where is that edema going to go, well, one thing that edema is going to go, it's going to back up into the tissues, and so our friend may gain some weight. So we might come in to see the doctor, and his weight is up. Why is his weight up? Well, all that edema that's backing up from the heart, it's backing up into the lungs, but it's also backing up into the tissues as well. So he'll have some swelling, he'll be gaining some weight. Maybe his belt size has gotten a little bit bigger. So weight gain, that's one good reason why doctors would check the weight. Well, what else might happen? So that edema, that fluid could build up, and I'll draw this in with a little different color, but the patient, our friend, may be getting some swelling in his legs, some edema building up in his legs. Why is that? Well, the legs are the most dependent structure, and some of that fluid, that edema, backing up from the heart into the tissues can start building up in the leg. So we might see weight gain due to that edema, that tissue building up. We might see edema, that peripheral edema, especially in the lower extremities like we showed here. So it's all a function of that edema. If that edema builds up in the lung tissues, the patient's going to have difficulty breathing. Dyspnea, and a rapid respiratory rate. Tachypnea, might have some trouble lying down. Orthopnea, what about that edema backing up into the body? Well, weight gain. Certainly the patient could have weight gain. What else could they have? The patient could have edema in the lower extremities, building up in the lower extremities. So those are all the features that we're going to see as that heart is failing. It's just a pump. The pump backs up. But that pump when it backs up is the edema fluid collects in the tissues. And where the tissues are, where it collects, are going to dictate a lot of what kind of problems the patient's going to have and how's the best way to manage them.